how much you pay for a hospital stay or a doctor's visit could be changing. Some employers are telling workers that from now on, their company health plan will pay only a fixed amount for medical tests and surgical procedures. One giant California firm is experimenting with this strategy is Calpers, the California Public Employees Retirement System. So, will other companies do the same? Joining us now to talk about this, James Robinson. He's professor of health economics at the University of California's Berkley School of Public Health. Professor Robinson, most people would probably be happy to know that healthcare costs are going to be coming down in one way or another, but tell us what you think are the pros and cons of this California pilot program. Is this something that works to the benefit of consumers as well as businesses?
What employers have been noticing is that for the same sorts of procedures, different doctors and hospitals are charging radically different prices. And so the cost to the employer, in this case, can be dramatic without any improvement in quality or outcome for the patient. So Calpers, Safeway, and a variety of other large employers have developed what we call reference pricing, by which they mean they will pay up to a certain amount for a particular procedure, and that amount covers the costs at a wide variety of providers, but not at the most expensive. And if the patient wants to go to a more expensive hospital or ambulatory surgery center, the patient has to pay the full difference by him or herself.
So it may lower the overall costs to the carrier, to the employer. It might, if you elect, raise your cost if you choose to go to one of the hospitals that doesn't buy into this pricing program. Isn't this, Professor Robinson, fundamentally what Medicare already does? In other words, they say we have a certain set fee that we pay for this procedure or this kind of doctor time, and that's one of the reasons why, with their pricing power, their prices or costs are lower than what most insurers or certainly people in the private market pay.
Medicare is able to pay less than private insurers because it's so big that the hospitals have to accept what Medicare is willing to pay as what Medicare will pay in full. But private insurers do not have that kind of leverage. They negotiate with hospitals and try to get the best prices they can. But frankly, the hospitals have merged. The hospital systems have a lot of bargaining power. And what Calpers in California found, Calpers represents public employees, state of California, and cities and municipalities, is that they were paying prices that range from $20,000 up to $120,000 for the same procedure, which was knee or hip replacement surgery. And so what they said, they had a benefit design put in which said, we, Calpers, will pay up to $30,000. And if you, the member, want to go to a hospital that charges above $30,000, and we will tell you which ones are which, then that's fine, but you have to pay the difference yourself. That way, Calpers pays less, and then Calpers takes less out of the paychecks of the employees. That was the goal, was to take less out of the paychecks.
We've been talking a lot about cost. What about quality? Because that's the question I'm sure a lot of employees will have, that, so we get the price down, but what is going to be the clinical outcome for me with that procedure or that surgery? And is there any way you can really measure clinical outcomes and quality?
There are a variety of ways of measuring quality, all of which are limited, and that's a standard problem in healthcare. What Calpers and its insurers and others did in this case was to use the available quality measures that were available for orthopedic surgery to ensure that the average quality of the hospitals that were fully covered, the cheaper hospitals, was no worse than the more expensive hospitals. That's a standard finding in healthcare, that higher price does not equal higher quality. And they also made sure that a lot of what we would call brand name hospitals were in the cheaper half, such as Stanford University Hospital, Cedars-Sinai Hospital, other very famous hospitals in the California market.
Well, it seems like a lot of issues still to be worked out, but very interesting concept. Thank you so much, James Robinson, professor of health economics at Berkeley.